So hello everyone, good evening. Myself Dr. Tanima Singhal and I welcome you all on today's Q&A session. So let me start the session. You can put your questions in the chat box. Till then I'll take the questions which were asked by you all on the Google form. So first question is from Said Shabana, low milk supply issue. So Shabana, what is the age of your baby and what is the formula intake and all that thing? You need to first let me know. So if you are facing low milk supply issue, first you need to work on your demand and supply. So if your baby is taking formula milk, whatever time the baby is taking, and just try to feed your baby for every demand feeding. And if your baby is not coming on the breast, try to pump. And along with that, just improve your intake of water. So take at least 3 liters of water every day. And along with that, do oil massage and warm compress. And also you can take galactogogues like lactomagic powder and Morico tablets. Along with that, just keep the baby skin to skin and keep tracking the baby's formula intake and baby's weight gain. Next question is from Sakshi Tyagi. My 3-month baby refusing to take my feed. So was the baby taking feed previously and suddenly refused? If this has happened, this 3 months is the growth spurt period. During the period, the baby starts seeing colors and all those things. So that makes the baby agitated and sometimes confused. So that's okay. Just keep the baby skin to skin and keep trying for feeding the baby. Next question is from Sunita Pagadala. She says that low milk production and baby not gaining weight. So for low milk production, I have just informed how to increase the milk supply. And if the baby is not gaining weight, after every breastfeeding, just see the color of the milk and just express that milk and give it to the baby. Next question is from Manjusha Pentakota. Less milk production. So I've already answered about the low milk supply. Next question is from Prachi Jain. Low milk supply, demand and supply is not meeting. So if you're facing low milk supply, I have already answered, and a demand and supply is not meeting, then please try to improve your demand and supply. That will improve your milk production. Next question is from Bonosa Sebastian, latching issue. So if you are facing any kind of latching issue, you need to work on a cross cradle hold. That will help your baby to latch in a better way. Hold the breast in U shape from below, from the side where you have to breastfeed the baby, and hold the baby from the other hand. And when you are bringing the baby towards the breast, make sure the baby's head is extended. Chin should touch the breast and will be embedded, and let the baby open a big mouth, and then only you latch the baby. That will help the baby to have a deep latch, and you can work on your latching issues in this way. Next question is from Priyanka Taylor. Low milk supply. I have already answered. Ramandeep Grover, baby don't take breastfeeds. So why is the baby not taking breastfeed? First, see what has happened. And if the baby is still not taking breastfeed, at least pump to keep up your milk supply. Next question is from Sriya Das, latching issues and low milk. I have covered both of these right now. Shilpa Shri, low milk supply, already covered. Vanita, less breast milk, already covered. Next question is from Saranya. For my first child, I am not having enough milk. I used to formula milk. Now for my second baby, I am having milk, though I am having thought of again I will suffer from low milk supply. So one tips to increase the milk supply. I am not using any formula milk for my second baby. He is enough with my milk, and he is newborn and born on 18th November. So first of all, congratulations that you are not facing any low milk supply issues with your second baby. And please don't worry. Just keep checking the baby's weight gain. If your baby gains weight properly, then don't worry about the milk supply issue. And if you want to still improve your milk supply, just follow the tips I have already told right now. Next question is from Sandhya. Low milk supply, painful breastfeed. So if you are facing low milk supply and painful breastfeeding, then low milk supply I already answered. About the painful breastfeeding, you need to work on the latch and follow a deep latch method that will improve the baby's latch, and the baby will be able to have a deep latch and you will not have any pain. So first question is from Swati. I am taking the questions now from the chat box. I have taken for 1 month, but after 1 month, milk is decreased, and how many days we can use Lactomagic and Morico tablets? So Swati, if you are following the maintenance protocol properly, then the milk supply will not go down. And if it is happening that way, just reach out to the helpline team. And this Lactomagic and Moringa tablets you can continue for like whatever time you want, but the doses have to be decreased slowly. So just see if you are following the maintenance protocol properly. If not, just follow the maintenance protocol. The milk supply will never decrease like that. Next question is from Plabita. Hello, ma'am. Can you elaborate on use of the specific allopathic medicine? Does it always work? And does it have any effect on the baby? No, it will not have any effect if it is prescribed to you by the lactation consultant doctor. And don't worry about, because it is very safe, and the long-term usage, maximum we can use it for 8 to 10. There are two kinds of allopathic medicines, but has to be given as per the like requirement. And Plavita, because you are already in our paid plan, so it is better to talk to the doctor directly for these things. I think you are connected with me also. So let's talk about this on our next call. Right now, whatever I have told you, start taking that. It is all safe, and the doses, etc., whatever is given to you, just follow that. And we'll have a one in our next call. Like if you are concerned about anything, we will discuss that. But right now, just continue the treatment, whatever has been given to you. It is all safe. Next question is from Pooja. Milk supply is high in the morning, but as the day sets, milk supply gets lower, almost no milk at the pumping. That's fine, Pooja. If you're also a breastfeeding mother, the milk supply will vary in the pump. Don't worry about it. Just keep creating the demand after the feeding till we are giving the pump, the formula milk. Once the formula milk will go away, we will stop pumping. But right now, if your baby is not at all coming on the breast, then please continue pumping. Don't worry, the milk supply is not coming in the pump. Just keep creating the demand. That will help your brain to understand the increased demand, and it will help you to increase the milk supply. You can keep writing your questions. Plavita, thank you so much. No worry. I'm really happy with your consultation. That's so glad, Plavita, and keep going. Keep moving strong, and don't worry about the like safety issues. All the medicines which are prescribed from our doctors are absolutely safe. Don't worry at all. So keep writing your questions. Till then, I'm taking the questions from the Google form which you have filled. Next question is from Apurva. My baby is 2.5 months old and stopped latching and also low milk supply. So anyhow, you're answering your question by yourself. If the supply becomes low, the baby, obviously the baby is hungry, the baby is growing with time, and the baby understands the importance of like the baby is hungry, the baby understands the flow of the bottle and all that. So in that case, the baby will start refusing the breast. So work on your flow, work on your supply. Your baby already knows how to latch. You just need to work on your flow and the supply. Next question is from Swati. I have already answered right now. Aksha Sheikh, low milk supply. So I have already answered for this. Monica Balagari, milk supply, already answered. Kausalya, I don't know how to fix my baby's mouth. So you don't have to fix your baby's mouth. Just make sure when you are bringing the baby on the chest, just tickle the nipple on the baby's upper lip. The baby will open a wide mouth. And if the baby is not opening a wide mouth, just wait for 1 or 2 minutes. Just tease the baby in a way, bring the baby towards the breast and don't give the milk. That time the baby will just get agitated and will open a big mouth, and then you latch the baby. Next, Raghavi, low milk production, already answered. Bhagya Rekha, low milk supply, already answered. Chandan, Afreen, Subha Tyagi, Asmita Chavan, sub all same questions. Ramya, low milk supply, the answer I have already done. Sankari, holding postures and how many times and intervals to feed. So holding postures is the most common and the most recommended is cross cradle hold, where you have to hold the breast from the side where you are feeding, the same side in U shape, and hold the baby from opposite hand in a way that the baby's nose is towards the nipple. So this is called as the cross cradle hold, which is very good and very helpful for having a good flow. Sorry, having a good latch. And how many times and intervals to feed, that is all as per the baby's demand. So feed the baby as per the demand. Sania, relactation. So relactation is a good question. So for relactation, first of all, you have to work on your demand and supply. So for demand and supply, if your baby is not at all coming on the breast, then start pumping. Start pumping, and you don't have to pump for long, pump for 5 to 10 minutes, but keep it regular and try to do at the same times. That will give your brain the stimulus to start making milk, and follow the the other pointers which I just discussed about low milk supply. Lakshmi, extremely low milk supply, only a drop. Don't worry, this looks like a case of relactation. Just follow the process which I have just discussed. Don't worry, the milk supply will definitely increase. Pooja Sheth, latching as well as low milk supply, already answered. Elakia, low milk supply, already answered. Sobita, low milk supply, already answered. Radhika Joshi, breastfeeding. So what is the question related to breastfeeding? Deepa, low milk supply and baby not feeding directly on the breast. So if you're facing low milk supply, obviously the baby will find difficulty in latching on the breast. So start pumping regularly and keep giving that milk to the baby. Keep checking the baby's weight and keep track of formula milk. As the formula milk will start coming down, baby's weight increases, then it will give you good confidence. Kitty Sonkar, low milk supply, already answered. Pallavi Adik, cluster feeding. So good question about cluster feeding. Cluster feeding is more common during usually 24 hours. The babies do cluster feeding for 3 to 4 hours, which is very normal. Usually babies do from 5:30 to 8:39, which is again very normal. That is nature's way of keeping the body on high alert to make milk supply, more milk supply. Regarding the cluster feedings during the growth spurts, specifically the growth spurts are between 2 weeks, 6 weeks, 3 months, 5 months, and 7 months. During these times, the cluster feeding will be like visible or can be experienced throughout the day, which is again normal. So don't worry if you're facing low milk supply with this kind of thing. That's perfectly fine. Next question. So you need to just check the baby's weight and keep a track of formula. So if the baby's weight is increasing, you don't need to worry about the cluster feedings. The baby's demanding frequently on the breast during the growth spurts is normal. Otherwise, in 24 hours, 3 to 4 hours of cluster feeding is also normal. Next question is from Pallavi Desai. How to wean off from nipple shield have been using since a month. So what you do whenever you are putting the baby on the breast, for some time just try to feed the baby, specifically when the baby is little sleepy and all that. That time you remove the nipple shield, and before removing the nipple shield, do massage on the breast, express a little milk so that once the baby comes on the breast, the baby gets milk in a short span of time, and the baby doesn't have to make a lot of efforts on that. So this way you will be able to wean off the nipple and nipple shield. Just keep working on it. Slowly, slowly it will start weaning off. First it will start weaning from the night, and slowly you start doing it during the nap times in the day, and slowly it will start removing from the other times also, Pallavi. एसपी मिल्क क्वालिटी कैसे बढ़ाएं? मिल्क क्वालिटी के लिए आपको अपने डाइट पे वर्क करना है और बाकी अपना पानी का क्वांटिटी बढ़ाना है। मिल्क सप्लाई के लिए सॉरी मिल्क फ्लो के लिए आपको रेगुलरली मसाज और सिकाई करना है, जिससे आपका मिल्क का फ्लो अच्छा होगा तो बच्चा ब्रेस्ट को जल्दी एम्प्टी करेगा। मिल्क जितना जल्दी एम्प्टी होगा, मिल्क का सप्लाई बढ़ेगा। मिल्क की क्वालिटी के लिए आप अपने डाइट और न्यूट्रिशन पे ध्यान दीजिए। Prabhita, can milk become watery in some days? I have seen this last few days. That's perfectly fine because as the milk supply starts increases, you will start seeing that the milk quality becomes sometimes watery. But if the baby is gaining weight and the formula milk is coming down, then Prabhita, nothing to worry about it. SP, relactation में मिल्क सप्लाई 100% मिल सकता है क्या? अगर आप पूरे एफर्ट्स अपने 100% लगाएंगे तो बिल्कुल मिल्क सप्लाई 100% मिल सकता है। Pooja, is tablet Domstal 10 mg safe to take for lactation? I have been prescribed this from doctor for low milk supply. Also, instead of Morico tablets, can I drink Moringa leaves tea every day? So first, it is very safe. You can take it because it has to be prescribed by a doctor, and regarding like as per the if it is a required thing, so we usually prescribe it if the baby is taking formula milk more than 4 times a day. So if the doctor has prescribed, take it. It is very safe, and it is given during pregnancy as a DOM DT tablet, and also during for the babies if they are vomiting. So since it is safe during pregnancy, and for small babies it is very safe to increase low milk supply issues during breastfeeding. The doses has to be always decided by the doctor. So whatever dose she has told you, just start taking it, Pooja. And instead of Morico tablets, can I drink Moringa leaves every day? So the Moringa leaves tea, the amount of moringa which I want in your diet is more required. So instead of that, take Morico tablets right now, because Morico tablets is 1000 mg. The potency is, and that will give you very much benefits of moringa. And how it is made, the Morico tablets which we suggest is the leaf extract tablets. So it is not the powdered leaf tablets. So extract of the leaves and then made into tablets. Obviously, the potency will be much, much higher. When you are making tea, it will be a very diluted kind of a tea. We will not be able to have the dosage what we want for moringa. So that way, I would prefer having Morico tablets instead of your moringa leaves tea. You can continue having leaves tea, but also take Morico tablets. Monisha, ma'am, how to increase milk supply? My baby is 2 months old, currently on breastfeed and formula. I think, Monisha, you have joined late. I already answered about how to increase milk supply. I'm repeating it again. So you're saying that baby is 2 months old and breastfeed in formula. So what you do after every breastfeeding session, you just pump the milk for 5 to 10 minutes. If you get milk or not, just continue doing the pumps. Along with that, improve your hydration, work on your flow by doing oil massage and warm compress. Along with that, you take galactogogues like lactomagic powder and Morico tablets, and you just keep taking keep the baby skin to skin with you, and keep a track of baby's weight gain and how much formula you're giving. Slowly, you will start seeing the improvements in overall milk supply. SP. Supply means quality of milk can be 100%, baby will not need formula. वही मैं बोल रही हूँ एसपी कि ये पूरी तरीके से हो सकता है, लेकिन आपको जो जो चीजें बताई जाएंगी या बताई गई हैं उनको आप प्रॉपरली फॉलो करेंगे तो मिल्क सप्लाई पूरा 100% आ सकता है, लेकिन आपको उसके लिए अच्छे से पूरा करना है जो आपको बताया जा रहा है, पेशेंस के साथ करना है जिससे सारी चीजें अच्छे से इम्प्रूव हो. Monisha, thank you for your guidance, ma'am. I'm glad that it is helpful for you. So I'm not seeing any new questions here. If there are any questions, you all can just let us know. So let me know. SP says, thank you, ma'am. You're most welcome. So there are no new questions, and the Google form questions I have already answered. I don't see anything new. So I think that's all for today. Okay. So there are no new questions. Thank you so much, Pooja says. You're most welcome, my dear. So Monisha says, ma'am, do babies always sleep if they are breastfed properly? It doesn't happen that way, because as the babies grow, they want to play, they want to explore the world. So every time they will not sleep, but you will see a steady weight gain in their, of course, in their growth. And after 3 months, you will also see a steady increase in their height. So if their height and weight is increasing, they are happy, they are not very cranky, then it is perfectly fine. The babies are doing good with exclusive breastfeeding. Okay. Okay. So that's all for today. Okay, one more. So Swati says, after stopping medications, milk supply is decreasing. Domstal tablet and Morico tablets can be taken for 6 months. No, it should not be taken like this randomly. You would, if your treatment was completed, you would have been given up this maintenance protocol. You have to follow that. And if the maintenance protocol was not given, that means you left the treatment in between. So after always completing the treatment, we always give a maintenance protocol to each and every mother. So if it was not given to you, that means your treatment was not completed. Renew your call and talk to the doctor and see what happened in between. Milk supply will never go if you are not, if you have followed the maintenance protocol properly. SP, domperidone taking is good if it is advised by your lactation consultant doctor. It is perfectly good. Monisha, thank you, ma'am. This time is very challenging for we mothers. You are doing a great deed. I'm so glad that you are appreciating that efforts, and keep working on your breastfeeding journeys and keep taking care. Just don't worry. We are all there for you. For anything you require, we are all there. SP, domperidone tablets कंटिन्यू लेने से साइड इफेक्ट तो नहीं होगा ना? सो अगर आपको लैक्टेशन कंसल्टेंट डॉक्टर ने आपको बताया है प्रॉपर्ली, आपको डोजेज में बताया है, आपको बताया है कितने दिन लेना है, आपको सिर्फ उतने दिन ही लेना है जितने दिन उन्होंने बताया है. जब उनको कम करना होगा तो वो आपको प्रॉपर्ली एक मेंटेनेंस प्रोटोकॉल के साथ कम करेंगे. आप बिल्कुल वैसे ही अगर फॉलो करोगे तो आपको कभी कोई प्रॉब्लम्स नहीं आएंगी. बाकी अगर आपको बीच में कोई प्रॉब्लम्स आती हैं तो हेल्पलाइन टीम को आप हमेशा बता सकते हो, उनके साथ डिस्कस कर सकते हो. अगर कोई दिक्कत होगा तो वो आपको उसको फौरन फौरन आपको हेल्प करेंगे. तो अगर आप हमेशा एक डॉक्टर के गाइडेंस में कोई भी मेडिसिन लेते हो तो आपको कभी कोई नुकसान नहीं होगा. Swati says, thank you, ma'am. You're most welcome, my dear. Okay. So now I don't see any new questions further. Okay, so that's all for today. Take care, everyone. Bye-bye. See you next Friday again. Bye-bye.